Deborah Jones-Weiss. I'm one of the CHARM Center co-directors, and that's CHARM, the Mental Health Disparities Core Director for the Center for HIV and Research in Mental Health. That's an acronym for CHARM. I want to welcome you all to our Qualitative Data Analysis Seminar. This is our second seminar, and it is my great pleasure to introduce Dr. St. George and Dr. DeSantis, who are back by popular demand. And will be presenting us with a presentation on qualitative data analysis. Those of you who may have been present for their first seminar learned all of the fundamentals for qualitative data collection, and now we're going on to the next level. And if you didn't do the first seminar, you can go back to the CHARM website and watch that seminar also. Before we go any further, let me plant a seed in your mind. At the end of the session, there'll be a QR code. That's one of those funny square codes that appear that you can click on with the phone and do a very brief survey. So let me say something about our distinguished presenters. Dr. St. George is an assistant professor in the Department of Public Health Sciences at the University of Miami Miller School of Medicine and a member of the Sylvester Comprehensive Cancer Center. She is a National Institute of Health investigator and has received a diversity supplement, a predoctoral fellowship, a KO1 Early Investigator Award, and most recently received a grant funded by the B Foundation for Cancer Research. So she has a very impressive and lengthy avenue or road that she took to get where she's at today. And so as such, she is really an ideal scholar. Her research focuses on developing and evaluating digital family-based pediatric obesity and chronic disease prevention interventions that target positive parenting practices and behavioral skill building to improve healthy lifestyle behaviors in ethnic minority youth, parents, and grandparents. She's currently teaching qualitative research methods and obesity and public health in the master's and PhD programs in the Department of Public Health Sciences. I believe it's going to be a school of public health at some point. Dr. DeSantis, Dr. Joseph DeSantis, is an associate professor at the UM School of Nursing and Health Studies. His research focuses on the intersection of HIV, HIV risk, and mental health among vulnerable populations such as Hispanic MSM and transgender women. And he's a fascinating speaker. He has served as clinical consultant with the HRSA HIV/AIDS Bureau and a clinical educational consultant for UNICEF. Dr. DeSantis is a member of the board of directors of the HIV/AIDS Nursing Certification Board, and he is also the new incoming co-director of the Mental Health Disparities Core for CHARM, who will be replacing Dr. Vicky Behar-Zushman, who is moving on to lead our developmental core. Congratulations to all. Please join me in welcoming Dr. St. George and Dr. DeSantis. Thank you.
Thank you, Dr. Jones. It's a pleasure to be here again today to share with you all a bit about qualitative data analysis. I think that after the first seminar, people were really hoping that this type of content would be covered. And so here we are back again. For those of you who did not get an opportunity to attend the first training, I wanted to just give you a sense of what was covered in case you do want to go back. So we talked about what exactly is qualitative research, when is it ideal to use. We talked a lot about data collection, specifically participant sampling and different considerations around sample size, which I always get a lot of questions about. Different types of data collection, including interviews, observations, audiovisual material, and records. Developing a question guide and ideal prompts, how those prompts should be conducted, effective interview skills, including reflections, for eliciting the most rich data possible. We talked a bit about equipment and recording procedures and transcription. And that leads us perfectly to where we are today. For those of you, I put the link here to where that recording can be accessed more specifically.
And maybe I can mention as you're going along, if people have questions, they can use the question and answer or the chat function at the screen. All they have to do is click on raise your hand and the questions will be seen by the presenter.
Yes, and we will do our best to answer those as we go and or wait until the end, but we'll certainly try to get to all your questions. So today we're going to be covering an introduction to qualitative data analysis, including some general consideration, a brief overview of just some different approaches, what's a code, what's a theme, considerations for using computer software, what are reliability and validity when it comes to qualitative research. And then Joe and I are each going to walk through examples, like a little deeper into two types of examples, one which would be a more general approach and the other one a more specific approach. So the general inductive and grounded theory approaches, so you get a sense. The idea is that you walk away today with some information and more resources as you move forward in your own qualitative studies. But I think we need much more in-depth training for you to be able to kind of do either of these right off the bat, just with today's training. So an introduction to qualitative data analysis. I think that if you walk away with anything today, that this is kind of one of the most important slides. What are some of the foundational things that you need to know and or do before you begin your data analysis, actually before you even begin your study? So the very first thing is to know your study objectives and your research questions. And alongside that is to identify an approach that actually matches your objectives. So you'll see today in each of our examples that these approaches that we're using are very different. And we have to know upfront, because each approach comes with its own vocabulary, its own nuances in terms of approaches and different coding schemes. So it's very, very important to know what your objectives are, link your objective to your approach, and make sure you're following the recommended guidelines and steps for that specific approach. When I review manuscripts that come to me that are qualitative, I think one of the biggest things I look for is, did they actually do the approach that they said they were going to use? And I find that in the health sciences research in particular, that everything is kind of commingled together, that we did qualitative research, but it's very light on the details and on the specificity regarding the approach. And then always systematically document your data analysis process so that you have a record of that process and can vouch for the steps that you followed. So when I teach my qualitative data analysis class, this is the book that I use, Choosing Among 5 Approaches. There are way more than just 5 approaches to qualitative data analysis. So this list is not meant to be exhaustive, but it's just meant to give you a sense of how many different approaches there are. And the way that I've kind of conceptualized this is putting it into either general approaches in qualitative research, some like just descriptive qualitative research, and then more specific approaches. So examples of general approaches that you might see in studies that you're reading are the general inductive approach, which that's the one that I happen to use quite often for the projects that I'm doing. They're usually intervention, development, and or evaluation projects. So it's not, I'm not developing any theories like Joe is. And also there's thematic analysis. Specific approaches, there's anything from grounded theory, phenomenology, ethnography, narrative approach, case studies. And again, all of these differ not only in their focus, the types of problems that are best suited for those approaches, data analysis strategies, and then the actual writing of the report. So for example, in a grounded theory study, the focus is on developing a theory grounded in data from the field. And you want to analyze data through very specific types of coding that Joe will cover: open coding, axial coding, selective coding. Your written report should include generating a theory that's illustrated in a figure. So these are very specific things that a grounded theory study should include. For an ethnography, the focus is on describing and interpreting a culture sharing group. So when you want to learn more about describing and interpreting shared patterns of a cultural group, this is the approach to kind of use. In this approach, data analysis strategies include description of the culture sharing groups and themes around that group. And when you're writing your report, you're really describing processes about how that group kind of works. So already you can see that they're different. So you have to make sure you know your research questions, match your approach to your research questions, follow the guidelines of your approach, and then you should be well on your way. So keep that in mind as you develop your research, your qualitative studies. That said, regardless of the approach, there's a lot of shared kind of feel for qualitative studies. They all have many things in common, regardless of the specifics of the approach. So regardless of the approach, analysis begins when your data collection begins. And often, you know, this happens, it's in the real world, it does happen where you collect all your data and then you transcribe it, and then you're like, oh, okay, now I can start analysis. But ideally, people who are collecting your data are also on your analysis team so that they have a sense of what's coming in. You can pivot if it's an emergent design. You can ask additional follow-up questions if you're seeing that things are interesting that are emerging as you go. And that's one of the differences between qualitative and quantitative research, is this idea of the emerging design and following the story where it goes. Regardless of the approach, you must also become deeply immersed in your data and question all the conclusions, the prior conclusions that you have based on what you have discovered. So my little icon here, reread, reread, reread. And when I give you my example, you'll see just how much I reread usually all of my transcripts in different ways. The general steps to data analysis are to first prepare your data. So what does that look like? Usually it's a written transcript of your interviews. And in this sense, interviews are the mainstay of qualitative research. So how are your data ready to prepare them? One of the things that I always do is I have my team kind of cross-check the recordings that I've received from a transcription company, listen to the audio and read what they wrote to make sure that everything is there, add things that are anything that's missing or something that the company might have found to be inaudible. So that's how I kind of clean and check my data. Reducing your data is a process of then, okay, you have these, you know, let's say a 60-page transcript, and you did 15 interviews, so you have 15 60-ish page transcripts. The process of reducing your data, starting to code it, breaking it down into themes, and coming down through a funnel to get to where you tell your story. And then finally, how do you represent your data? This is often done in quotes, in tables, in figures. So figuring out what the best way to capture your data is. So those are the general steps. And really at the heart of qualitative data analysis is this idea that you're just finding patterns and putting the patterns together. Okay, so you're clustering similar ideas. So what are codes? Well, codes in qualitative research are when you begin aggregating your text into smaller categories of information. And again, you'll see this will become more clear as the presentation evolves. But if I have, you know, somebody speaking and a paragraph worth of what they say, they might have talked about several different ideas within that paragraph. So it's the idea, the coding is putting it into these smaller categories of what's happening. Now, there are different things to consider when you're coding. You know, how do you develop your codes? How do you count your codes? Is that something that you should do? Do you use pre-existing or a priori codes? How do you determine code names? You know, are they exact words or segments from the participants? Is it terminology from the literature? And these are all things that you think about and discuss up front as you're developing your coding scheme. As you'll see with the general inductive approach, which is the approach that I use most often, the participants' voices are what help me generate the code. So even if I have like a broader umbrella, like family communication, I don't know necessarily what's going to go under that umbrella. And that's where their information helps me kind of populate what those different codes should be. And I do this not by reading one transcript, but by reading a bunch of different transcripts and putting everything at first and then starting to pare down. In terms of counting the codes, I think it depends on how what your codes end up looking like. So for example, will you be more broad in your coding, or do you want your coding to be more specific? So if I have family communication as one code, any instance of when they talk about family communication might fit under there. But then what if they're talking about family communication positively, or they're talking about conflict? So, you know, do I decide with my team that I want to have separate codes for that? And so if I count them when they're all together, if it's just under this family communication bubble, what is that really telling me about the data? So you want to make sure that if you are going to look at numbers, which I do, I mean, it's not that I don't report them necessarily, but I like to see how many kind of codes are come across, but I always keep the context of how I define the code in mind when making that decision. And then pre-existing or a priori codes. Sometimes people tend to think about some sort of theoretical framework before going into their study. This is not necessarily the case with grounded theory, where the goal is to generate theory, but you might want to understand something simple like facilitators and barriers to getting an HPV vaccine. And so you maybe use the theory of planned behavior to help you identify, different, what might come up, and that helps you put together your question guide, and then that might lend itself to codes that fall under those categories naturally. So that, again, the most important thing is to think about all these things up front, and it should stream through the entire life of the study, not just all of a sudden pop up in the analysis phase. So if you have a theoretical framework that you're using up front, then you should be mentioning up front. It should help you generate your questions. It should be seen in your coding scheme, and definitely in how you report the findings as well. So then what are themes? Well, themes are clustered ideas, and they bring meaning to the experience. They capture and unify the nature of the experience into a meaningful whole, and most often they emerge directly from the data. So I always have people ask me, well, what's the difference between a code and a theme? And one thing that I see in my classes, especially for beginning qualitative researchers, is that they try to go straight to the theme, and they're already finding themes when really I have to, make them step back and say, yes, that might be a theme, but right now we're doing the codes first. So I developed this visual to help my students understand how themes and codes are related. And here is this umbrella. So many codes can form a singular theme. So themes consist of several codes aggregated to form a common idea. And then what do you do with the themes? So here we have like our entire study. We might be reporting 4 different themes in this study, each theme comprised of all the separate quotes. And so then you make sense of all the themes. You tell your story. What's the larger meaning? What does this all mean anyway? And again, this all should be linked to your objectives for your study. So again, one thing the first thing I ask people when they come to consultation with me is, what is your research question? What is the goal of your study? So that's a little bit about codes and themes. And again, you'll see more of that when we dive into our examples. Another thing that comes up is, so you go through the codes. Should I use computer software? And what are the advantages and disadvantages of using computer software? So computer software, I've used it in every single qualitative study I've ever done. I tend to think of, when I read my transcripts, I have developed this little, I don't know if this is in the literature, but I kind of developed. So when I'm reading a transcript, I'm viewing my data vertically, meaning I see the one transcript and I see what's happening for each individual at a time, or each focus group at a time. But when I use a software program, what it helps me to do is look across all of my transcripts and look across all of my interviews in ways that my brain may not have been able to do. So the advantage of qualitative software is it helps you organize and store data, locate material easily. You can literally click on a code and see all the excerpts that fall under that code, allows you to look at your data in different ways, as I was just talking about. They often present really nice visuals and just things to look at your data, and you can easily retrieve your notes. What qualitative software programs don't do is analyze your data for you. And so that's something that I've had some people ask, like, oh, it's kind of like R or a statistical software. You kind of put your numbers in, write your model, and then boop, you get your themes. No, that's not what qualitative software programs help you do, at least not yet. So the brains behind the operation is still you as the analyst, but this helps you conceptualize your data and organize it in ways that you may not have had at your fingertips had you not used it. Disadvantages of using computer software programs are that they do cost money, although we as University of Miami faculty, staff, and students have free access to Nvivo. You do have to learn how to run the program and all the features, so there is a learning curve. Some people say that it puts a machine between you and your data. You're a little bit separated from the computer. I don't tend to feel that way, but put it out there. Varying ease of accessibility. So again, some software programs are not easily accessible or very costly, and may not have the necessary features. that you would like for your study. So it's very important to look into that in advance. Here are some available programs that you might consider in your studies. Nvivo, Deduce, Atlas, ResearchWare, MaxQDA. This list is not meant to be exhaustive either. And I personally have experience with Nvivo and most recently with Deduce, because up until we got the license as a university, Nvivo is quite costly. And so Deduce was a much more affordable alternative that I use for my projects, and that you only pay. It's a cloud-based software and you only pay when you actually use it, like $15 a month or something like that. So I did find, here's a good resource for everyone. There's a link here, this computer assisted qual data analysis networking project. You can search that, but if the slides are shared with you, then you can click there, and it's a program that allows you to, I see a question. What are some transcription service you use recommend? So I have used the National Captioning Institute. And I'm sure Joe has used another. They're very good, very fast. They are pricey, but they have a secure portal for uploading all of my transcripts, and I usually get transcripts within like 4 days to a week, and I've sent them like 21 transcripts at once and have gotten them back very, very quickly. So the National Captioning Institute, and I'm happy to connect you with them if you would like. I answered that live. Okay, so if you go to this link, and I can show you, so I can take you there for a second. It has a list of all of the different, hold on, it's going, here we go. So it has a PDF document that corresponds to each different possible software program that you might consider. And let's click on Nvivo. And in this PDF document, it tells you a little bit about the background. It tells you about the system specifications, the structure. It shows you kind of what the window looks like, types of data formats that it can use. So for example, if you're doing a qualitative study that has pictures and you're not sure if the software program can handle pictures, this is a nice program where you can come and read a little bit more about the different kinds of software programs that you're considering to ensure that they can actually handle the data that you have. So that's the software program. Okay. This is an example of a Deduce, and I'm actually going to log into my Deduce as part of my, when I talk about one of my studies, so you can see how I've used it. There's a link to some tutorial videos. That's another nice feature of some of these software programs, is that they do have, Deduce in particular has links to various short video clips that are very specific, like how do I upload a codebook? How do I actually code data? What are the different analysis features? So you can go and watch those tutorial videos to figure out how to use the program. And again, I'll give you a tour in a second. And then kind of the last big picture kind of thing with regard to analysis that I would like to talk about is reliability and validity, and what that actually means for qualitative research. So when it comes to a qualitative study, reliability is all about the consistency of the coding. So if you're going to have multiple raters, which I always tell my students, you know, there's different levels of rigor in qualitative studies. And, you know, if you have one analyst, then a reviewer might view that unfavorably. If you have multiple analysts, then they can start seeing that there's maybe some consistency, there's shared definitions or shared ways of viewing your codes. So it's the consistency of your coding. How often do your raters agree on the codes that you're putting? So it's very important that you decide what exactly your coders are agreeing on. Are they agreeing on code names? Are they agreeing on specific passages? Are they agreeing on the way entire passages are coded? Are they agreeing on codes versus themes? So the definition of what needs to be agreed upon should be hashed out in advance of deciding how to do inter-rater agreement. When I do my studies, I've managed anywhere from teams of 2. I've done one. I've had a very simple analysis of after I did an intervention where I asked them what they liked and disliked, and it was a very brief thing. So I did that one myself. I also just recently managed a coding team of 7 coders, including myself. And so, you know, you have to decide, when I code, I usually code by idea. So did they catch the fact that the idea was in that passage that was in my coding book? And not line by line. I do it kind of idea by idea. So if a participant talks for an entire paragraph, but only like 3 of those ideas are reflected in our coding book, did both coders capture those 3 ideas? They didn't have to bracket off the exact start and end to the T of a sentence, but they had to capture that those 3 ideas were present in that passage. So that's something to agree on, and there's different ways to determine inter-rater agreement, and I'll talk about that in a second. So the steps to inter-rater agreement are to first find additional raters, develop a living codebook, and the reason I call it a living codebook is because your codebook should evolve throughout the course of a study and throughout the process of training all of your coders to understand it in a similar way as possible. Choose a method that you're going to use to calculate inter-rater agreement, conduct inter-rater agreement, and determine if inter-rater agreement exists, and revise your coding scheme as necessary. So here's a helpful figure. The initial inter-rater agreement is a signal to you of whether or not your code book or your coding scheme is where it needs to be in terms of its level of specificity and in terms of how your different raters view it. So here's an example. You create your code book. So coders 1 and 2 develop a code book based on an initial reading of the responses. You pull a random sample of transcripts and allow them to code it. So they code the transcripts independently, and then you calculate an inter-rater agreement. And that can either be a percentage agreement, which is less formal, and so that's basically the total number of times that they agreed over the total number of codes that were assigned. Or a more formal way to calculate this is a Kappa statistic. So a Kappa is, again, a formula to determine degree of agreement minus what could be expected due to chance. It ranges from 1 to -1. And good agreement, according to Cresswell, is between 0.6 and 0.8. Very good agreement is from 0.8 to 1.0. So again, if you're shooting for percentage agreement, 85 to 90. For Kappa, good 0.6 to 0.8, very good 0.8 to 0.1. So then did your, if you pulled this random sample, did your coders reach an acceptable level of agreement? If yes, then you move forward with analyzing the rest of your transcripts. If no, then that's a clue. You need to go back to your code book. Where did they disagree? Why did they disagree? Could you add some sample quotes to your code book to make it more clear? Could you maybe refine the definition? Do you need to split away 2 of the codes? Are they getting too, is it too nuanced? Could you maybe bunch them into one larger code so that they kind of agree more, and then later on in analysis, you can split those if you need to. So these are some of the considerations. And again, I'll give you details about the study. Okay, let me see. I have another, I answered that question. Okay, let's continue moving. Okay, and then, so again, reliability in the context of a qualitative study is consistency in coding. Validity is the accuracy of the account. And you know, what you need to do to depict the accuracy of your account is you need to convince your reader that it's an accurate account. And so how do you do that? There are things that you can do to lend credence to the accuracy of your account. And I put some of these data validation strategies here. So one, triangulation, is that you have multiple sources. So you might have transcripts, you might have pictures, you might have written documents like a diary that some of your participants completed. When you put those pieces of information and integrate them together to form a picture, it lends to the accuracy of your account because they're seeing that this information is coming from multiple sources. Disconfirming evidence is something that I always look for in my studies as well, because it's unlikely that every single person that you interview is going to agree. And so, you know, a reviewer might ask, or a reader might say, well, what are some areas where they didn't, or what were the exceptions to the rule? So looking for disconfirming evidence or those exceptions as you're going through your transcripts and codes is helpful, and reporting them in your paper, in your theme passage. Reflexivity is something that's very common in qualitative studies. Unfortunately, we don't often have space to write about this in some of our journals just because of space constraints, at least not at some of our content journals, I should say. Qualitative journals often do allow for this, which is where the researcher shares his or her beliefs or biases and what led him or her to do this study. And that allows the reader to decipher, again, the accuracy of the account if they know where the analyst or the researcher is coming from. Member checking is about going back to your participants, not necessarily with your entire transcript, not necessarily with your code book, but going back to them with the themes and saying, this is what we picked up on. What do you think about that? Do you have anything to add? Does this reflect what you stated in your interview? And typically what the best way to do it, the most effective way, is to get people together, even if you did individual interviews, in like a focus group and present the themes to them that way. Prolonged engagement in the field. This often happens in ethnography studies. It's where you build trust with participants over time, and by being in the field so much that you can write about that, how immersed you were. Again, that lends to the accuracy of your account. Collaboration is also kind of synonymous with community-based participatory research, is when you involve participants in key decisions throughout the entire research process. And that, again, gives the reader a clue that, you're reflecting the views of the people that you're representing. Rich description is when you provide the readers with a detailed account of the setting and the participants. So I actually just mentored a student through publishing a qualitative study that was about a social connectedness in 3 different rural towns in Mexico. And these towns were extremely different, even though they were all rural. Like, one of them didn't have internet connectivity. The kids, had one school down the road and it was very difficult to get there. Others had a little bit more capacity. And so in the beginning of the paper, she wrote about a description of town A, town B, town C, because even some of the themes that came up were different based on the town where they were coming from. So providing that rich description allowed the reader to understand why that might have happened. And then finally, an external audit and or a peer review. So they're different things. An external audit is an outside review of the accuracy of the study. And typically you would want an external auditor to be someone who is an expert in qualitative methods to really just determine whether or not the methods were done well and in accordance with the approach. Whereas a peer review is someone who's actually familiar with the content and they look at the study. So this often happens like for doctoral students, for example, that are doing work in a particular area. Their mentor is an expert in that area and they bounce ideas off the coding and the themes with their mentors, and their mentors might help them come up with ways of naming the codes or naming the themes that, because of their expertise in the literature, they can help make sure that that's reflective of the body of evidence and or nuances that they might not have been aware of. So, and then you would write about which of these validation strategies you used in your method section. Okay. Any questions? Let me look at my Q&A here. I answered the questions about the transcription service. I have a few more. I'm just not, the one that I use again is National Captioning Institute. Anybody have their hand raised? No? Okay. So I will continue to move forward. So I am going to be talking to you about remember there are specific approaches and general approaches. And today it's nice that you are going to get a sense of one of each. So one of the more general qualitative approaches is called the general inductive approach. And this is the key paper. So it's Thomas 2006. It's published in the American Journal of Evaluation. What I really like about this paper is that it gives a step-by-step of how this general approach is. For those of you doing a thematic analysis, the key kind of classic paper there is Braun and Clark, 2006 or 2007, one of those two. And what these two papers do, again, is give step-by-step procedures. You're not just saying that you did an inductive approach. You know, inductive means that it's from the ground up, that participants' voices are the ones that are kind of informing where you go. But again, it's very important to have kind of a reference that you can link to the steps so that people understand what exactly you did. So a general inductive approach, in a general inductive approach, the data analysis is guided by the evaluation objectives, which identify domains and topics to be investigated. The analysis is carried out through multiple readings and interpretations of the raw data, which is the inductive component. And although the findings are influenced by the evaluation objectives or questions outlined by the researcher, the findings arise directly from the analysis of the raw data and not from a priori expectations or models. Sorry, I have a special guest here joining me to our topic today. So we'll just keep talking as she sits here. Okay. Oh, I have a question. Good question. What is the difference between a thematic analysis versus a general inductive approach? Yeah, different purposes. So with a thematic the general inductive approach explicitly states that it is the process is grounded very much so in the evaluation objectives. So everything's very much tied to your objectives. Thematic analysis is a bit more open. And you know, it allows you to a little bit more leeway in a sense. And the steps are pretty similar, but there are some different nuances to the different process. But that's kind of the main difference between the two, that the general inductive approach is very explicit about being guided by the evaluation objectives and yet still being inductive in nature. So that's kind of the key difference. Okay. Hold on one second. We're just gonna go check in with Daddy. Okay, hold on. Sorry about that. Okay. So here's a comparison of qualitative analysis approaches. I'm just going to go through general inductive and grounded theory because that is what we're kind of talking about today. So if look at these side by side, the analytic strategies and questions. So in a general inductive approach, you're asking, what are the core meanings evident in the text relevant to the evaluation or research objectives? Again, that's what I talked about earlier. Whereas in grounded theory, the strategies or questions are to generate or discover theory using open axial coding. What is the outcome of the analysis in general inductive approach? Themes or categories most relevant to the research objectives identified. And then the presentation of findings is a description of these themes. Whereas in a grounded theory approach, a theory that includes themes or categories is what is the outcome of the analysis, and your presentation of findings is your description of the theory that includes the core themes. Okay, no new questions. Moving on. So what is the process of a general inductive approach? The very first step is to clean your data. And I described that earlier, cross-checking your transcripts according to your audio text is typically one of the first steps that I take. And then a close reading of your text. Read and reread as many transcripts as you can consume, really, as you develop your codebook. Then you create your categories. And in a general inductive approach, there are two different types of categories. So you have your upper level or general categories, and those are very much based on your study objectives, whereas your lower level or more specific categories are based on your data. So there you see the general inductive approach at work. You have these bigger picture categories that are based on the objectives. Then what comes underneath them is based on your data, what your participants report. You do overlapping coding and you code the text, and then you revise and you refine. In the process of coding in a general inductive approach, you you're going to have the goal is to parse down to get to your themes. So you're going to have many, many pages of text as you read through the initial data. You're going to identify specific text segments that are related to your objectives. So that's many segments of text. Then you're going to start labeling those segments of text to create your categories. You might have anywhere from 30 to 40 categories, maybe even a little bit more. You start to reduce overlap in those categories and start parsing it down. So you want to go down to maybe 15 to 20 categories. And then finally, you create your themes and you parse down even further. How can you put those codes together to get to somewhere between 3 to 8 themes are what's kind of recommended as the output from a general inductive approach. So here's an example of a code book that I would use in one of my studies. And I always assign the code a number because I like to code with my hands and the paper in my hand. The code name that corresponds to it, a very specific definition, any sample quotations, and decision rules. And one thing that is very important, is specifically for inter-rater agreement, is to make sure that you have these clear decision rules that give your coders clues for how to act. So here is an example of when a decision rule is important. Let's say that a person A is talking and they're talking about general family communication, and then all of a sudden the interviewer interrupts them, reflects their statement, and then they keep talking underneath. So, you know, do you code that, and they keep talking about general communication underneath. So do you code that twice because, you know, they were kind of interrupted, or do you kind of consider that one passage that's all falls under this general communication code? And that's something that your team decides. So, and here's another example of a more specific, that's a general decision rule. Here's a more specific decision rule, which is, you know, should you use this code for both verbal and nonverbal descriptions of general communication? So either when they're talking or when they're mentioning like body language, like my mom, you know, crosses her arms when I'm talking to her. But do not use this code when participants are describing communication related to their weight, physical activity, or diets. Those excerpts are better captured using code 1.3, which is health-related communication. So that's just a nuance of this particular code book, for example, of something that I was looking at because I was interested in general communication versus health-specific communication in families. So here's an example of a transcript, and not for you to read the whole thing. These are adolescents that I interviewed many years ago, and but just to show you what I do when I go through and code. I bracket off the text and I assign it to the code that it corresponds to it in my code book. So what I think about my body is that it's healthy. I ain't gonna say that I'm my right weight because I know I'm not, but the other way is that my body is good and healthy. So that went with whatever 13.6 was in my code book at the time. In fact, a lot of these went with that. And then at the end, I think I'm beautiful no matter what anybody says. It's my opinion. And even people don't like me that much, I still know that God loves me. So that went with a 13.3 in that code book. So this is how I go through and code the actual text once I have my code book. So I'm going to take you behind the scenes of, that's a little bit about the general inductive approach. I'm going to take you behind the scenes of one of my most recently published study. And the goal of this study was to develop a multi-generational digital lifestyle intervention for women cancer survivors who are grandmothers, their children, and their grandchildren. And I'm actually in the process of developing that intervention right now. We followed the first 6 phases of a framework for designing digital interventions called the IDEAS framework. And each of those phases kind of correspond to a user-centered design, which is where you involve the end users in all stages of intervention development. So what we did was we recruited 46 grandmothers with breast, endometrial, or ovarian cancers. They were about 66 years old, 34% were Hispanic, 33% were non-Hispanic Black, and 33% were non-Hispanic White. They first completed a self-reported questionnaire about their lifestyle behaviors, their family structure, their mobile device use, and their interest in family-based interventions. And then we randomly selected a subset of 21 participants, 7 from each racial and/or ethnic group, and completed individual interviews with them to understand their family relationships, their weight-related challenges, and to get their feedback on intervention kind of content and initial prototypes. Very important that you are transparent about your measure, which is your qualitative question guide. So as you can see, I have the topic area on the left. So these kind of correspond to my evaluation objectives. And then the open-ended questions that each participant was asked that corresponded to each of these topic areas. So for example, family relationships and support, we asked, how would you describe your relationship with your family members? We had prompts for children or grandchildren because we wanted to understand those differences. What impact has your cancer diagnosis had on your family? How, if at all, did your family help you during your cancer treatment and survivorship? With regard to their weight, have you ever struggled with your weight or weight loss? If yes, describe your challenges. How motivated are you to lose weight currently? We wanted to understand their motivation for prevention. So the question was, what, if anything, do you think you can do to help prevent cancer in your family members? And then this is not the only question. We had a couple others about their interest in the intervention. Question is, would you include probes when publishing the interview guide, or is it just the actual structured questions? I think it depends on how much space you have. Sometimes people have way too many probes to put for each question. So yes, you can stick to the general questions. And then just maybe in the text, let the reader know that in addition to these general questions, you had several follow-up probes in case other areas of discussion were not raised, such as example, give a few examples there. But I don't think it's necessary to publish all your probes. I did put the children and grandchildren one in the first few because I wanted to understand differences there, and I thought that was important for my readers. But I didn't necessarily have probes for every single question there, just what I thought was most relevant to the study objectives. Okay, then what I did was I had so this is a study where I had 7 different raters on our coding team. And first, one author read a subset of transcripts to develop an initial codebook based on participant responses. So here is like the first couple codes that were in the codebook. And so you see you have the code number, what the name of the code was, any definition or examples, and then any sample quotes that corresponded to it. And then any notes that I wanted to give my coding team, I could kind of maybe write a note there, highlight it in the text. So this is the living codebook that I talked about. So the very first pass at developing this is to have, I had in this study, one person read the several transcripts, I think like a third of them, and come up with this code book, okay? Then after that, as a coding team, we got this code book and I had everybody on the coding team read another subset of transcripts that were all different and make suggested changes to the code book. And once we had that version of the code book, we then moved to the next step, which was to have everyone code 3 transcripts together. So everybody coded the exact same 3 transcripts. And we came together and discussed how we coded those 3 transcripts. What about them was different? What about them was the same? How could we continue to revise our code book based on everyone's feedback? And the idea is not only to revise your code book, but for me to see how everyone was understanding the different codes, what nuances were coming up. So we did that. And then once I felt that we had a good enough draft of the code book, I don't just let my coders run loose. I monitor very closely where they are in their process. And so since I had a team of 7, I had a team of 7 very strategically, I always pair the same 2 people together. So I consider me the 7th coder. So I had 3 teams of 2 raters. That way they could, you could foster kind of inter-rater agreement because they're working together. But in order to ensure that across the coding teams, they were coding similarly, I, as the 7th coder, coded one transcript with every single member of the coding team and calculated that reliability into our inter-rater agreement calculation. So that's the system that we used for this study to ensure not only that the pairs were coding similarly, but that I could make sure that all the pair across the pairs, they were coding similarly as well. Each pair would code one transcript, and then we would meet as a team and say, okay, what issues did you come up with? What are the discrepancies? Do we need to change the code book? If you do change the code book and it affects other coding pairs, those pairs then need to go back to their transcript and make sure that every single one of their transcripts reflects the most recent version of the coding book. So you need to make sure that you have good version control when you are developing this living code book, because it does change throughout the study. There does come a point, however, when you say, okay, at least for me, when I say, okay, this is, we've gone through this exercise several iterative times now, this is the final version, and we're moving forward with this. Anything else that comes up can be kind of put maybe into an other kind of interesting category that I can then come back to and look at later. So that's the iterative process that I take to coding, and it does require recoding some transcripts based on the most recent version of the transcript. So here's our code book. As you can see, it says version 4.0. Okay, so then once all of our transcripts are coded, which you can do the coding in Deduce or any qualitative software. So I'm going to log in and show you this project. I then enter the codes into a qualitative software program. So again, me and my team reading each individual transcript was about that horizontal level of analysis. We read each transcript one by one, but then I want to look across or understand across transcripts. So that's why I use the qualitative software program. So here's Deduce. I'm signing in now. Hopefully it doesn't take too long. But I'll show you my dashboard, and I'll show you this. I already have it open to this specific project. So I'm just going to orient you to what I see when I'm opening my software program. So here on the left, I basically got my code book, the one that you just saw on the previous page, and you enter each code into this code book. So here are all the different codes, that we had in this study. Over here is your media. Media are each different transcript. So if I want to see this transcript, for example, and none of these transcripts have identifying information, I'll pull it up. And what you do is you very literally highlight your piece of text like this, and then assign it to one of your codes. So you're dragging and dropping the codes onto the text for every single one of your transcripts. Some people, you can use this and do it on the computer. I always like to have my team's code on paper because I like to have them kind of erase, go back. It's just a personal preference, but you can have people code on here too, and you can erase and go back here too. It's not like you can't, it's just my style. So that is where all the media are. Whoops, didn't mean to log out, sorry about that. And then what you can do is you can click on a particular code and see the different excerpts that correspond to that code. So once I have all of my transcripts coded in Deduce, I use the software program to understand my data in new ways. So what does that mean? Well, first I extract excerpts. I extract every single code and all the excerpts that correspond with that code, and I reread all the excerpts that correspond with each individual code. So if you click closeness and view coded excerpts, it'll show me here every single excerpt that corresponds with that code of family closeness. Okay, so I export this and I print it out, or I don't, or I haven't been printing it out because it's a lot. So I just read it here, and I write down notes and I say, okay, does this really reflect closeness, or is this need to be further broken down? So that's how that's another way that I go into the data vertically. Now I go code by code, all the experts. You can also enter descriptors into your software program. So what you'll see here is that I linked the participant demographics to each of the coded excerpts, because I wanted to see how each code was reflected in my transcripts for the 3 different racial ethnic groups that I had in this study. So that's a nice thing that you can do with the software. And then finally, you can see kind of some visuals that it allows you to see. Two other kind of charts that I look at, and I'm not going to take you through everything, is the code application. So here, what I see is all of my codes up top, and then all of the media, meaning all of the transcripts along the sidebar. And I get to see, okay, how many times was this coded in transcript number 21? 3 times it was coded for closeness. But what I really look at here is the totals at the bottom. So seeing which codes seem to be very highly endorsed. Why might that be? I go back and read the excerpts. So it's not that I'm going to report necessarily these frequencies in my qualitative study, but it's another way for me to understand my data, and you can report them if you want to. And then code co-occurrence, which is, did these codes did they co-occur? You know, so, and I'll share with you one instance of when a co-occurrence was interesting in a second. So these are the different things. You can export these tables and look at them more closely. I usually export all the excerpts that by code as another layer of understanding of my data. Then this is the part that I think is the most difficult, is what do you do with all this information? So this is what I do. I take a good look at my data all together, all of these different things, the code co-occurrence, the code application, and I go back to my objectives. What were the objectives of this study? The objectives of this study was to use the qualitative data to help me develop an intervention. Well, what are my intervention considerations? And that was the question that I kept in mind as I went through and defined my themes more specifically. I also like to make sure that my themes are all written in the same tense. So in this study, all of the themes were action verbs. Capitalize on an existing familial closeness and support. You'll see the other ones now. So here are all the corresponding codes that speak to capitalizing on existing familial support. So you see now the umbrella. Here's the theme. Here are the multiple codes. You see that I even have a section on disconfirming evidence. Where is this not happening? And then my notes after I read the expert. So what I noticed, so largely close family ties. They reported receiving support despite the emotional impact of cancer on their family members. And this is where I put things together, and literally then what I take is this and I use this to help me write my results section of my papers. So here were the themes for that study: capitalize on existing familial support, involve local family members who need lifestyle change, tap into survivors' internal strengths, validate prior weight loss successes, overcome barriers to sustain lifestyle change, provide information on cancer risk, and motivate families with reinforcing activities. And this is the way that I present my quotes in a paper. And one of the frustrating things about kind of publishing papers sometimes in non-qualitative journals and the content ones is that you don't have, your data are words, and there's a lot, but you don't often have space. So I always put this in I like to put it in a table. And so here are all the different, here's the theme, number 1, capitalize on existing familial support, and all of the supporting quotes, number 1.2, 1.1, 1.3. Then when I'm writing my theme passage, as you see here, the in-text references in parentheses are referring to what quotes correspond to that theme. So here's how that theme passage came together. So the theme was capitalize on existing familial support. Nearly all participants described very close family ties and maintained regular contact through phone, video calls, text message, and or social media. Survivors reported multi-generational support despite the emotional impact of cancer on their children and grandchildren. Family support was provided through logistical help and or emotional encouragement. The few participants reporting minimal familial support described cancer as the loneliest time and having family members who were in denial. So all of that, my 21 transcripts, and this is like these 4 sentences were what it boiled down to because of space. It like hurts my qualitative heart, but this theme passage captures everything. And then the quotes, I let the quotes kind of tell the story for the reader. So that's, oops, sorry, I don't mean to go ahead. Let me see if I have any other question. Is there any other advantage to using Deduce over Nvivo aside from the cost? Not really. The cost was the biggest factor for me. And honestly, now that Nvivo is free and Deduce costs $15 a month, I might switch over to Nvivo, although now I have to kind of refamiliarize myself now that I'm more familiar with Deduce. But essentially, Deduce does everything that I would want it to do and need it to do. And so it was very easy for me to use. Are there any other questions about general inductive approach or qualitative data analysis more generally that I could answer now? I want to make sure that Joe has enough time, and it's exactly 2:30 on the nose. Okay. With that said, I would like to turn it over to my esteemed colleague, Joe, for a picture of a more complex, specific approach, the grounded theory approach.
Okay, thank you, Sarah. I'm going to try to share my screen here, and hopefully I don't lose everything or lose anyone. Can you see my screen?
Yes.
Great. All right. So, Sarah, thank you. You kind of gave a lot of overview for kind of what I'm going to talk about going forward. And I don't want to repeat anything that you said. I'm just going to reinforce some of the things that you kind of talked about, because, you know, these are qualitative approaches. So there's some overlap, you know. And so I want to talk about grounded theory because I'm more familiar with grounded theory, and I use that in almost all of my qualitative research. And I want to give you an overview of this grounded theory methodology. And
Joe, you might want to put on the slideshow.
Oh, okay. I'm trying. Let me see here. Hold on.
It's up on the top.
Oh, how about that?
Yep, there you go. Thank you.
Okay, great. So I want to kind of talk about, you know, an overview of grounded theory methodology, and I want to describe and talk about some of my research that I've used with using grounded theory to study HIV infection and mental health. So I'm going to give you a quick overview of grounded theory. What is it? A lot of people that do qualitative research, they consider grounded theory the highest level of one of the highest levels of qualitative research methodologies. Now, again, this is kind of who you kind of consult when you think about this, but really grounded theory is kind of a higher level because it requires a little bit more work, if you will, than some of the other methodologies. This is not to say that grounded theory is the best. You have to have a little bit of background in grounded theory to be able to use it. And for some people, it's like a little bit too complex and a little bit too abstract and a little bit too out there. But I kind of like it because it makes sense, and I'll tell you how it really fits in my work in just a second. So Sarah kind of mentioned this earlier, but grounded theory, if you pick up anything about grounded theory, they're going to talk to you about how it's grounded in the data. So, you know, everything that you're going to see generated in a grounded theory study is really grounded or rooted or found a foundation in the data. And so you're going to see that term grounded in the data used a number of times. Grounded theory is used when you want to describe or illustrate a social process. And just like Sarah pointed out, it uses a lot of these categories and subcategories that attempt to provide an explanation or a theory of how that social process occurs. So even though it's called grounded theory, and even though you do quote unquote generate a theory, what you're looking at there, the theory that you're generating, is actually how the social process that you're studying, how it unfolds, how it occurs, how it emerges, if you will. And that's all what grounded theory is about. And, you know, it seems really high level because you're thinking about theory, but really, you know, theory explains a process. That's a general definition of a theory. It explains how something happens, or explains a process. So that's why grounded theory has that theory piece in its name. And, you know, like I said, a lot of people hear theory and they think, oh, that's too abstract, it doesn't make any sense. But once you start to use it and you start studying it, you see that it does make a little bit more sense. Grounded theory was actually developed in the 1960s at the University of California, San Francisco School of Nursing by Barney Glaser and Elsem Strauss. And both of these gentlemen were sociologists, and they studied dying. They studied death and dying. And they wrote a famous textbook that's called The Awareness of Dying. And the book came out in the 1960s, and they were co-workers and collaborators, and they're both given credit for the development of grounded theory. But later, the two of them split up, and they both disagreed about who discovered grounded theory. And so you will see, like after I believe the early 1970s, they were working separately. And so they both kind of continued to develop their method of grounded theory, throughout the rest of their time. Strauss kind of, when he kind of split from his partner, his research partner, he kind of formed another relationship with Juliet Corbin. Dr. Corbin, I believe, was his graduate student. And they really developed one of the first textbooks for grounded theory. And I used this textbook when I was a PhD student, when I took my qualitative research classes. And then when Dr. Strauss passed away in the mid-90s, Dr. Corbin continued the work, and you see the book has kind of progressed and changed a little bit, and now she's the first author. And this is kind of really, if you're going to do grounded theory, this is kind of one of the books that you want to pick up, because it really covers everything that you need to know. Also, oops, sorry about that, very sensitive screen there. Also, if you look at another person who's written a good bit about grounded theory, it's Dr. Kathy Sharmaz. And she wrote this, this famous textbook called Constructing Grounded Theory. And of course, she calls her approach constructivist grounded theory. And her work stemmed from her research on chronic illness and management of chronic illness. And you see the book, the original title of the book was Good Days, Bad Days, The Self and Chronic Illness in Time. And she was very interested in studying and how people, manage their chronic illnesses and how they manage the self during times of chronic illness with, the exacerbations and the remissions. And so she's, I believe she's also a sociologist, and she does a great deal of work also with nursing. I believe at one time she was on nursing faculty at some university. And so if you pick up either two of these books, either the Sharmaz book or the Corbin and Strauss, you've kind of picked up the, the authoritative texts on this topic. And they are both fairly similar, but they each have their own little approaches that they kind of use. So I invite you to check out these books to see if either of these are, if they resonate with you as far as grounded theory. So with grounded theory, and Sarah covered some of this, grounded theory uses an extremely structured interview guide. And I'm going to show you some, later on, I'm going to show you some like interview type things that need to be included in a grounded theory interview. It's much more structured than, for example, in a phenomenological study. And you really have to follow the points in the grounded theory interview in order to generate the theory according to the experts there. With grounded theory, you want to make sure in your interview guide that each participant receives the same questions initially, okay? And then when you get to a point that's kind of predetermined by the person conducting the interviews and analyzing the interviews, you may add questions, you may delete questions, or you may revise questions as the data collection continues, okay? So some of these questions, you may feel that you need to add additional questions, or you take away or you revise those questions as the data collection process unfolds. And in grounded theory, it's very important that the researcher brackets their assumptions. And when we say that you bracket your assumption, we mean that you acknowledge up front what biases you come into the study with. Okay, so if you're working clinically with people with HIV and mental health issues, and you are now studying them in research, your clinical practice may influence your research. And so it's important that up front that you bracket those assumptions that you have. And bracket just means that you acknowledge that there could be bias, okay? And that your experience or something about you may influence your putting yourself into the interview. Strauss and Corbin and Cresswell and probably Sharmaz also recommend that when you're doing grounded theory, you keep field notes. And the field notes you write after every interview, and it helps you not only keep track of what you think you heard in the interview, but it also helps you acknowledge your own bias, and it kind of keeps you honest, if you will, with the field notes. And there's a lot of different ways to use field notes. It's kind of outside the scope of what we're talking about here today, but they can be really helpful. And like I said, not only helping you keep track of what you're hearing, but also kind of decreasing your bias along the way. Sorry about that. So when you are developing your interview questions for your interview guide using grounded theory, there's really something that you have to include. And your interview questions have to allow the participant to describe the social process, okay? So that's going to be occurring. So, you know, it's kind of like, I kind of break this down into the kind of the what, the where, the when, and the how, if you will, of using grounded theory. So your questions must allow the person to describe what's occurring. That's the what. Your questions must help contextualize the social phenomenon. That's where it occurs, okay? It also, you must include timing, that's the when, the influences on the social phenomenon, what promotes it, what inhibits it, okay? Kind of the barriers and facilitators, if you will. That's kind of a how. And then the questions have to allow the participant to tell what occurs in terms of consequences because of this social process that's being described, okay? And this is kind of a complex thing for people to kind of wrap their heads around. And again, it's kind of outside of what we wanted to do today to kind of, to teach you to write grounded theory type questions. As we always put ourselves out there, I don't consider myself an expert in grounded theory. I've just used it a good bit and I've learned lessons along the way. And I am always very happy to help someone who thinks that they might want to do some grounded theory and to kind of do the questions and all of that. So I'm putting myself out there as kind of like a little plug for anyone that would need who wants to do this and who would need some type of consult along the way. When you are conducting the grounded theory interview, these interviews are very complex. Remember, you're asking people to describe how something happens. And so sometimes these interviews are, really complex, and they typically last way longer than an hour. I think the longest I've ever interviewed a patient was, a participant was 2.5 hours. And actually I probably would have gone longer with that participant, but I kind of ran out of recording space. And at the end of the interview, the participant said, I know I talk a lot, but I just really like to talk about this issue. And I got such great data from that interview. So you're going to have to be prepared that if you're conducting these interviews, an hour is a minimum. An hour just gets these participants warmed up. So, you know, you're gonna get a lot of data out of these participants. Because it's so much time, the participants are gonna get tired. They're gonna have sometimes very strong emotional responses. You know, I've had a lot of, you know, acute stress that happens, an acute stress response that, you know, I've needed to stop the recording and kind of, you know, process with the participant and then pick back up when the person's much better. So during these interviews, the whole process can take you about 3 hours per interview. By the time you do the, you know, the consenting and all of that good stuff, the participant's they're gonna be tired. So if you can provide them with some refreshments, something to eat or drink while you're doing this, it would be great. And also, I see a hands up. I'm gonna get to that question in just a second if you let me finish this slide. I think it's also important when you provide refreshment that, you know, you provide adequate compensation for this participant's time. If you're taking up 3-4 hours of their time to do this interview, it's really important that you adequately compensate them. Not only in terms of, you know, refreshments, something to eat, something to drink, but also in what you're compensating them in terms of that. I believe there's a question. Would somebody like to ask a question? I do not see any chats on my screen or any questions on my screen. I just see a person raising a hand. If you want to, if that person wants to talk, okay, that person's typing, I'm sorry. I'll try to answer the question.
Christina, you can unmute your phone, your microphone, and talk.
Christina, did you hear that information?
Yeah, can you hear me?
Yes, I can hear you.
Okay, cool. Yeah, I was having trouble wording the question. So, well, my bracket is I'm an epidemiologist, so sort of the opposite of what you guys are doing. But when you're talking about conducting the interview yourself, I sort of am wondering if it would be less biased for like an independent person to do the interview, sort of the equivalent of like blinding in clinical trials, because they wouldn't like know, say for example, they wouldn't know the research question or anything like that, or does that matter?
Well, to qualitative researchers, no, that does not matter. And I'm going to tell you from my own experience, I collect all of my own interviews. I do the interviews myself. And, you know, some of this may be just my own control that I'm, you know, not willing to kind of, to kind of give up. But I think if you had an outside person to collect your interviews, that person may just be, you know, giving the questions kind of in a very automatic, almost robotic fashion. And they may miss some things that are really important because they may not know what you want to uncover there. So for example, if somebody starts talking about something that's unrelated, okay, as a researcher, I may probe that person and say, okay, let's go with this. What are you talking about here? Let's kind of go with this and see where this kind of goes. And somebody who doesn't have that knowledge may miss something very important there. So yeah, so there, I don't really believe, and you know, Sarah can chime in here to see if she's ever done this. I've never known of anyone to kind of like let like an independent party collect the interviews and do that. Sarah, do you have anything you want to add to that?
Yes, I actually find that the more well-versed you are in the objectives of the study, the better it makes you as an interviewer. Because if you're not doing something like grounded theory and you want something, you know, you're looking for very specific information, you know when a tangent is a good tangent to go on, when
Correct.
a tangent needs to be reined in, and oftentimes just getting like a data collection person to do that, they may not understand those nuances. So if it's okay, I've used staff to interview people, but I make sure that their training is very good. But because there is this piece of reflexivity as one of the data validation strategies, you are the one that lets the reader decide whether or not that was a bias or a strength of your study. So transparency is just the key.
Absolutely. Yep. Christina, did we answer your question appropriately there?
Yes. And I have to do some reading about qualitative. This is my first introduction to it, so I think I'll just read a little bit more to get a better understanding, but thank you.
Yeah, and it is truly a foreign language. If you are very much versed in clinical trials, this is almost a foreign language, or it's a different philosophy that also may be a little bit, you know, heresy, if you will, because it seems like it's a little bit, you know, it seems like it's a little bit loose, if you will, and there might be too much bias, but, you know, it's the philosophical approach that you're coming from.
Gotcha. Okay.
Okay, so with qualitative research, we require that participants are active participants in the interview, okay? So remember, we're asking them to give us detailed descriptions of what's occurring. So really, you know, we're gonna be asking very open-ended questions, and as I described to you in the grounded theory type piece, the questions are developed to really get at what we're looking at here. And, you know, this may also, like, you know, sound very foreign to you if you're coming from a clinical trials type approach, but when we do grounded theory, we select participants who can adequately and completely describe the social phenomenon. So when I'm, you know, enrolling for a clinical trial, I use what's called theoretical sampling. And that means that I want to select the best people who can give me the best description of what's happening, okay? So, you know, you might call that selection bias, or, you know, whatever you're talking about, you know, whatever terms you want to use there. But really with grounded theory, you want people who've really experienced the phenomenon. So for example, I'm just going to give you an out there example. If you had somebody who you wanted to know about, you know, the health impacts of living through a hurricane, okay? Well, somebody who's never lived through a hurricane is not going to be able to, you know, to describe the phenomenon. And someone who's never experienced anything positive or negative from a hurricane is not going to be the best person to give you that description, okay? And the other thing that I look for is a person that is very verbal and very vocal and that can talk. Because, you know, even though you're giving people open-ended questions, you know, sometimes you'll get responses like, oh yeah, that was hard. Okay. And then you have to really work with them and, you know, get them to really describe to you what was hard about it. You know, what did hard mean? How was it hard? What occurred that made it hard? And sometimes you have to do a little bit more probing. And so what I do with theoretical sampling is I want to make sure the person meets my very clear inclusion or exclusion criteria. And then before I enroll them in the study, I sit down with them and have like a little conversation. And I see how they talk and how they express themselves. And then I figure if that person's a good candidate, you know, for the study. And that, you know, again, you may consider this a little bit of selection bias, but it really helps us really figure out the best person to participate in the study. Because remember, in grounded theory studies, it has one of the largest sample sizes, but you know, you're not having hundreds of people in a grounded theory study. You know, how big is appropriate for grounded theory study? There's still debate on this. And typically the general rule says that you need about 20 to 50 interviews for grounded theory. I've seen so many numbers between those two. Typically, I have found with my grounded theory work that usually somewhere between 20 and 25 usually gets the job done. And how do you figure out the job was done? You have this thing called saturation. And Sarah and I talked a lot about this in the first workshop that we did. We talked a lot about saturation. So basically what you do there is you just determine with your researchers and your research team that you've collected these interviews and no new information emerges. Now, a grounded theory person would say, well, okay, no new information emerges. Do we need to rework the questions? Do we need to add additional questions? And again, this is very subjectively determined. And so when you write your results of your grounded theory study, you just have to be very transparent and very honest about how you determined that saturation occurred and what you did about that. Grounded theory also recommends, as most qualitative research does, that when you think you've reached saturation, that you collect 3 to 5 additional interviews to really confirm that saturation has occurred. And of course, you always use a second researcher or a research team to look at this to see if, yes, saturation has really occurred, okay? And again, it's very subjective, and we covered a lot of this in the first workshop. So if you want to go back and look at that information on saturation, if you haven't experienced this before, it would probably be helpful. Data analysis. As Sarah mentioned in her presentation, grounded theory uses 3 levels of coding, and they're called open coding, axial coding, and selective coding. And depending on which textbook you consult, they give you little different definitions, but they're basically the same. I use the classic Strauss and Corbin from 1990, and they talk about open coding as your first level, and you basically just develop a list of categories in open coding. In axial coding, you go back and you look at the relationship between the categories. And in the third level, in selective coding, you look at the influences, context, conditions, and consequences that have occurred. And you do this, again, it's way outside the scope of this workshop, but I'll just give you a basic little overview here. Basically what you do is you use what's called the constant comparative method. And I'm comparing transcript number 1 to all the other transcripts, okay? And we're constantly comparing them, and we're looking for these categories and these relationships, these influences, these context, conditions, consequences that are common across all of these transcripts. And the final end product of data analysis in using grounded theory is you come up with a narrative summary and a visual depiction of your results or your theory. Grounded theory data analysis takes a really long time, and you really have to have a group of people who kind of know how to do this and who can work together on this, because you're generating these 2-hour interviews and you're generating 30 participants. It becomes a very large number of transcripts, a lot of pages, a lot of data, and you can get very overwhelmed in the data, and it can kind of stop you because it's so overwhelming. So if you're going to do this type of work, really work with somebody who knows grounded theory and knows how this whole process works. And I will tell you, it is very, very time consuming. Okay. Let's see, I don't think, okay, somebody asked me a question. Okay, What are your thoughts on using grounded theory in mixed methods research? Is it possible? If so, would you recommend 20 to 25 interviews, or could it be less because it's mixed methods? Okay, so when you used mixed methods, and Creswell writes, John Creswell writes a book, has a book on mixed methods research, and he talks about the different types of mixed methods research that you can use. You could use grounded theory as your qualitative piece of that. If you're going to do so, you must stick to the rigor of grounded theory, because it is, it is very rigorous, and you have to make sure that you follow all the rules. You can't do, you cannot do, ask very general questions and then expect to get a theory out of those general questions. So yes, you could do it. And would I still recommend 20 to 25 interviews? I would say, again, because you're sticking to grounded theory, you would have to make sure that saturation occurred. And so if you reach saturation at 20 interviews, I think you could stop. One grounded theory study that I did, I had 19 participants. And my questions were very narrow, that what I wanted to study. And I actually reached saturation at about 15 or 17. And I collected a couple more. And I actually collected 20 interviews, but the 20th interview, the person didn't really talk much. So I kind of threw out that interview because it didn't really, contribute anything. And then I was honest in the write-up about that I did originally have 20 participants, but one of them didn't provide, any usable information. So, again, as long as you stick to the rigor of grounded theory, you may not even need 30 interviews. Okay, those are just general rules. And remember, as I said earlier, this is all debatable. This is all, it's not a hard and fast rule. You just have to make sure that saturation occurs, and you have a narrative summary and a visual depiction of your results, okay? So, and my screen seems to have frozen. There we go. Okay, so I don't want to get into this because, in the interest of time, I want to save us some time here. But, this is a slide from Sharma's, the Sharma's textbook, and how she really looks at this whole grounded theory process. And you see it's a lot of, we talked about the constant comparative method, we talk about the coding, we talked about these type of axial theoretical codings and all of this that's going to end up with your theoretical statements or your, or your depiction of theory. And if you really want to look at this, it's kind of the same thing that kind of Sarah really kind of talked about. You've got all of these codes that come together and form a category. And, these categories come in, into themes and concepts that kind of really end up into a grounded theory. And again, it seems very simple in this little lecture that I'm giving here. It seems, pretty cut and dry, maybe a little abstract to a lot of people. It's very, it's a very prescribed process. And if you're going to do this work, you kind of have to have someone helping you who knows a little bit about grounded theory. And, the reason being, it is a complex process, but it's not an impossible process. Let's just put it that way. And so you're going to need some help in kind of guiding, yourself through the whole process, from the generation of the questions through the interview, through the coding, and through the writing of the narrative. And again, this workshop is not meant to make you an expert in grounded theory. It's just to start you thinking about, you might want to do this. Sarah talked about this already, so I'm not going to spend a lot of time here because, data verification, you see it's got a little different name here in grounded theory. They call it rigor in grounded theory. How rigorous is your study? Okay, and there's at least 5 ways of maintaining rigor in grounded theory, and you should use at least 2 methods. to ensure that rigor has been maintained. And again, looking at, depending on what textbook you look at, some researcher or some authors say you should use 3 methods to ensure that rigor has been maintained. Whatever you use, you just must detail it in your report. Okay, here's the 3 that I use, excuse me. And Cresswell, and he has an updated, a number of updated books, but Cresswell writes a lot about maintaining rigor. And he, the 3 that I use is the audit trail, which I kind of talked about already, is my use of field notes, okay? I also use peer review and debriefing, okay, where I make sure that I bounce my findings off of my research team. And I also make sure that my findings are consistent with previous research and clinical work, okay? And if it does not agree with previous clinical and research work, then I've probably discovered something new. So it's just, you know, important that you have some type of peer review or debriefing, and that you detail how you did that in your report. And then Cresswell uses this term, thick, rich descriptions. And these are these thick, you know, these meaty quotes, if you will. You know, when I think of thick, rich description, I think of like a big piece of meat, you know, and it's going to show that these findings might be applicable to other settings and to other participants. Because remember, qualitative research is not really generalizable. And so your thick, rich descriptions make it that what you found here, it might be applicable to other settings. And I'll give you an example of a thick, rich description here in a second. You know, and it's really funny when I use this term one time, thick, rich descriptions, in a qualitative publication, the author or the reviewers went completely mad and about this approach. They didn't like this thick, rich description. What does this mean? And I had to refer them, you know, to Cresswell to really make sure that, you know, I was following what Cresswell had, you know, had described, and the reviewers didn't like that term whatsoever. They were, it doesn't look, you know, it doesn't, how do I say, appeal to a lot of people. And so sometimes when you get these people who are not qualitative experts, or they're not really familiar with this terminology, they're going to question what you have written. And I did receive a question here, and it said one of the slides looks like latent analysis. Has this ever been compared to grounded theory? I'm not sure I'm not sure really what the person is asking there. I have not seen grounded theory, you know, compared to latent analysis. Again, it may be, and I'm just not familiar with it. Someone else posted that thick description is a term from Clifford Geertz. Yeah, and thick, rich description is from Cresswell. He uses the term thick, rich description, and I have seen the term also from Geertz. So thank you for your comment there. Okay, when you report your results, one of the things that's really important in grounded theory is that you provide a really detailed description of the demographics of your study participants. And I'm going to show you in a second, like, what I mean by group data and individual data. There's really no correct way to report this. I've done it both ways. But when you start your grounded theory results, one of the things you want to do is really describe your population very well. Because remember, that's your participants, and their demographics are kind of your context of your grounded theory. So this is kind of the traditional way that that one would report their demographics. And you see here, I got a really small sample here. I only had 15 participants in this. So it's it's really just numbers, and it's just breaking people down into numbers. But this doesn't really tell you much about the individual participant. So if you really want to break this down, you could develop a table that looks something like this, where you could really detail the demographics of your participant. So when you go back and you report your results and you provide a quote by participant 1, the reader can go back and say, oh, participant 1 was 25, he was from Nicaragua, he's been in the US for 18 years, and so on. And that gives you kind of the context between about that person's quote. Again, there's no right or wrong way to report these demographics. Again, I've done it either way, not important. Okay, again, thick, rich descriptions. Cresswell talked about this, and I'll give you an example here of a thick, rich description. I was doing this study on sexual negotiation, and one of the things that kept coming up in this research about sexual negotiation was this thing about Latin culture. And obviously this study was with Hispanic MSM. And they talked about, why Hispanic culture doesn't promote safer sex, according to this participant. And I'm not going to read this to you because you can read this. And this was a quote for, how Hispanic culture influences sexual negotiation, or using a type of, using condoms as a form of safer sex. And so if you can provide these thick, rich descriptions like this, it really demonstrates that you have looked at you've really analyzed your data, and you've really provided the best quote to support your categories and your themes. Okay, now, Sarah mentioned this earlier, and it's very important to pick up. When you present these big, thick, rich descriptions like this, it takes a lot of space when you go to publish it. So you have to be careful, space-wise. And I'll tell you a funny story about that in just a second. The other thing was, you want to provide your, in addition to your thick, rich descriptions, your visual depiction from the theory. And this helps the reader understand what you were talking about, and it also provides some opportunities for future research. So, for example, this theory here, this depiction of a theory here, was from a study that I did with adolescents and young adults with perinatally acquired HIV. And this was kind of the theory that developed from when they found out that they had HIV infection, and the impact that HIV infection had on their adolescent and adult growth and development. Okay, and so you can see here that they talked about a lot of these disruptions, and again, I don't want to get into this because I could talk about this all day, but it kind of shows like how this whole process unfolded from disclosure into this theory that I called integration versus disintegration. And basically what this meant for the participants is, after they found out they had HIV infection, they were either able to integrate this whole, integrate HIV infection into their life, or they were not. And it had an impact on a number of issues. You can see it's the family, it's the coping self, it's the physical self, the psychological, the social, and the sexual self. And unless the person kind of, dealt with some of these disruptions, then the person's growth and development was stagnant, in other words. And this is what unfolded from the interviews with the participants. And again, this is a very lengthy process. Takes a lot of time it looks very simple now, and it looks very clean and neat now, but the data analysis and the working piece of this is very, very complex. I have a question. How will we get access to the recording of the presentation today? This will be posted, I believe, correct, Dr. Jones? This will be posted.
That's right. That's right. Yeah, it's going to go on the CHARM website. It usually takes us a few days to get it uploaded, but it will be there. Thank you.
Thank you. All right, we're almost finished. I'm running out of time here, and I want to leave some time for some more questions here. So bear with me here, my screen. So one thing I wanted to talk about, and Sarah kind of mentioned this, when you're going to publish your grounded theory results, find out if the journal accepts qualitative research, because a lot of them don't, okay? And then you got to kind of figure out, do you want to publish in a qualitative research journal, or do you want to go in your specialty journal? So do I want to publish my work in a qualitative research journal, or do I want to publish it in an HIV journal? That really kind of depends, and you have to really see what the journal's willing to accept. And you also have to pay attention to the journal page length, because grounded theory studies, you're typically looking about 30 pages of text, 30 pages of, just the whole report. And that's a lot longer than a lot of journals are willing to report, okay? Now, we talked about this in the first lecture in the basics of qualitative research, and I just want to bring it up again. When you send out something for review in qualitative research, just be prepared for the reviews that you're going to get. I had one that came in and they asked for all of these changes, and then after I made the changes, which of course increased the length of the manuscript, then I got it back and they said cut it down. So it's like, oh, you made me add all of this to the paper, and now I have to figure out how to cut it down to page length. So keep that in mind when you're definitely thinking about publishing your work. Okay, really quickly, and I'm not going to cover these because we're almost out of time, but I will be happy to send the link to all these articles if anybody's really interested in looking at them more in depth. But I've used grounded theory for HIV and mental health research with heterosexual Hispanic men, with people living with HIV, with adolescents and young adults with perinatally acquired HIV, with heterosexual Mexican-American men in relationships where IPV occurred, where they were the perpetrators of the IPV. I've used it with Hispanic MSM, which is my favorite research group. And coming soon, I have a qualitative study that's under review right now, fingers crossed, on transgender women and their HIV prevention needs. So here's just a number of the references for a number of studies that I have done that have used grounded theory, published in Western Journal of Nursing Research, published in Issues in Mental Health Nursing. Journal of Pediatric Nursing was my perinatally acquired HIV. American Journal of Men's Health for the Mexican-American men. Hispanic Healthcare International. Hispanic Healthcare International, I have to give a plug for this journal real quick. This qualitative study was like really long, and they didn't ask me to cut it down. And so I was really happy that they had extra space and were willing to make space for this publication. I'm going to stop right there because it's 3:18, and I want to give opportunity for anyone else to ask any questions. I know I went through some of this kind of quickly, and I know it's kind of the first time that a lot of you have encountered grounded theory or any type of qualitative research. And I know that both Sarah and I welcome your questions, and we thank you so much for hanging in there with us for the 2 solid hours. So thank you very much.
Thank you very much. Please, if you have a question or you'd like to chat, put something on the Q&A or chat box, and we'll refer you.
And thanks to everyone who asked those questions. I hope I was able to, it's kind of hard when you're talking reading the questions and kind of keeping up with the questions at the same time. And I hope we didn't miss any questions that anyone had.
I have a question. Maybe I can ask it while I'm just sitting here waiting for someone else. What would you recommend as good journals for qualitative data, and what's the best way to find them if you want to publish your data?
I'll give my thoughts on that, and then I'm sure Sarah has some thoughts on that too. One of the first things I look at in any journal, I think most journals will take a good qualitative study. I don't know that any journal says we don't accept any qualitative work at all, not to my knowledge anyway. The first thing that I really look at is the page length requirements, because if you have a journal that says 20 pages maximum, you may not be able to put a grounded theory into that journal. So that's one of the first things that I look at for myself. And then I kind of look at also the journal and to see if they've published anything that's kind of similar to what I want to put in that journal. And that kind of helps my my decision there. I've also sent queries to the editors asking them which one that they think is best. I find that HIV and mental health journals are a little more open to qualitative research. Sarah, you have any thoughts on that?
Yeah, so I more often publish in my content area journals than I have in a qualitative specific journals, but there's one qualitative specific journal which I really like, which is Qualitative Health Research. Mm-hmm. And in terms of whether or not your content area journals will be open to qualitative research, what I usually do is a quick search of the past 5 years of publications in that journal and see how many studies are qualitative studies. Yeah. Also make sure that you look at the instructions for authors, because actually this study that I just presented about the development of the intervention for the women cancer survivors, that was published in the journal Psycho-Oncology. And interestingly, they had a requirement in terms of the minimum number of participants that they would accept for a qualitative study, which was 20. Thankfully, I had 21. But I, it's just interesting what the different journals requirements are. So make sure that you search the journal's history for the last 5 years, see how many qualitative studies they've published, and then emailing the editor is also a great idea.
So now I have two requests. One is that Joe advance the slides so that we can do this survey. Thank you before you leave. And then the second request or the comment is someone is asking about whether or not you would have enough time to do a qualitative study in the 2 years that are usually covered by an administrative supplement grant. And I said to them, yes, but they added with the proviso, if I had no experience in qualitative research. That's a very different question. Would either of you like to field that one?
I teach,
Sarah.
Yeah, I was going to say, I teach a course in qualitative methods every spring. And so if that could be built into your timeline, I would recommend that, because I usually allow people to, part of my course is bringing in data to the class. And I've gotten several students who have actually published qualitative studies now after coming out of the class. And so I would recommend that you look for some sort of course that you could take either with or early in the timeline of that project or prior to submitting your proposal.
Yeah.
Joe, do you want to add to that?
Yeah, I'm going to say that we also offer a qualitative research class that's in the fall in nursing in our PhD program. And it's probably pretty similar. Qualitative research is qualitative research. We probably just have a little bit more of a nursing focus to that. I would really recommend if anyone's interested in doing this type of work, to hook up with somebody who has experience. Don't go out this on your own. And I know that both Sarah and I are willing to help, but you need to get some type of qualitative support behind you, because to kind of do this on your own in a very short period of time, it's taken me a year sometimes to analyze 25 transcripts. Just the data analysis. You know, the collection is the easy part. The analysis is really what you spend a lot of time on in qualitative research.
So now we have two questions, one from one of my favorite people and another one from someone I must be related to. So here's the first question. Have either of you used solicited diaries in your qualitative work? And the second question is kind of answered by what Joe was talking about. How long does the study take on average? And what were some ones that happened kind of fast compared to a long study?
Sarah, well, I'll start on this one since I made Sarah go first the last time. Solicited diaries, no, I've never used that. I think it's very interesting. I think it's a very interesting concept to think about. To look at that. I think it could definitely be, you could probably use that for a qualitative study. I don't know that you could use it for a grounded theory, because I don't really know that the person or persons would really address all of the components of the grounded theory. As far as which one goes fast and which one goes slow, they've all been really slow for me, all the qualitative studies, because it really does take you a lot of time. And if you can't really devote like a long period of time to work with those transcripts, if you put them down for a while and you pick them back up, you kind of have to start over every time, you do that. And, in academia, we teach, we're on committees, we're doing other work, and we don't always have all of this time just to sit and analyze data and to write, uninterrupted. And so they've all been a really long process for me. Sarah, what do you think?
So to the first part of the question, no, I have not used diaries either. But I think that it's just that I haven't needed to for any of my studies, but the analysis would probably be very similar. So it sounds like a cool thing to do. I just haven't done it myself. In terms of the length of time, so the fastest study I've done is probably the one that I reported to you all on. And there's a couple of reasons why it was more quickly than usual. I guess it was done within a period of probably like 6 months total. And the reason it was that fast was because, number one, I was recruiting participants that I had already encountered. So they knew us, they knew our team. We specifically selected a subset of the women who completed that quantitative assessment. And so because we had that relationship, they were more likely to agree to participate. Plus they already had consented to being contacted by us when they did that first quantitative part. So that helped, having an established relationship. The other thing that helped that go quickly was I had already used the vendor before for the transcripts to come in. And my analysis team, so I didn't mention this, but I always try to do my interviews in the participants' language of choice, and usually they're either English or Spanish. And I select a team of coders who are also bilingual. And I think that probably of the 7 coders, so I was one of them, I think 3 of the students on my team had already taken my qualitative analysis class and were my mentees. And so they already had experience with coding. And so that made things go faster. And I actually strategically paired them, each more experienced coder with a less experienced coder. So everything was very kind of like strategic. And the fact that I had that many coders helped us get through all the data more quickly without compromising quality, because that's why I coded with each other person and was very involved in the process. So that was probably the fastest one for those reasons. Otherwise, I guess it always depends, right, on how long recruitment takes and how experienced your team is in coding and how experienced you are in doing these things.
Mm-hmm.
So we've only got a few seconds, like 2 minutes left, but I can't help but ask this question that comes here. It says, have you done qualitative analysis of non-text data, for example, photographs? I know Nvivo used to have that option from participants. That's a fascinating idea.
I have not. I know that there's the other program, the photo voice, I believe, and I've only seen the demonstration. I've never done that. You know, I've never done that type of work. I like the interviews. I mean, you know, qualitative appeals to me both as a nurse and as a mental health person, because, you know, I feel that like qualitative research gives people a voice. And a lot of times when they're talking and they're telling me things in these interviews, I get really honored because they tell me something like I've never told anybody this before, you know. And I think that that's why I kind of like that, using the interviews and using the you know, the time to sit with the participant and engage the participant like that. And you know, you could probably use that with the photographs, the photo voice and all of that, but I've just never, you know, I'm kind of an old-fashioned type qualitative researcher, so I've never, you know, used those type of things.
I haven't either personally, but there was a group of students in one of my courses that actually did use photo elicitation methods, and I kind of actually prompted them to use it. They were looking at, I think, how people conceptualize like their workspace and how that impacts how they feel at work. So photo elicitation, I mean, they did code the photos for what the content of the photos, but more importantly, they used the photos to help prompt their interviewees in the context of their interview. So the photo served as a kind of like an offshoot, or to say, so why did you take this picture? What's important about this picture? And they had some very interesting things, like whether there was other people in the picture or not, whether it was their desk and what their desk looked like. So yes, no, I have not used them, but very cool as a tool for making your interviews richer, but also in and of itself to code the content of the photos.
Yeah, I will mention, as a psychologist, we teach whole classes on how to do photo interpretation, you know, describing what's going on in the picture. Well, with that very interesting question, I'm going to have to close us out for today and thank Dr. St. George and Dr. DeSantis for their very, very interesting qualitative data presentation, and thank everybody for attending and providing their feedback.